Hello everyone, today we will be discussing about growth milestones in children. Okay, starting off with gross motor functions. So for gross motor function, the first thing I would like to help you guys is by making a stick man. So remember this small figure, and let's divide this figure into four parts. Like first of all, a part just below the neck, the second part being at around the torso, in between the torso, the third part at the knee level, and the fourth part as the stickman as a whole. So I'd like you guys to remember the part below the neck to be as 3 month, at 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 middle of this torso to be 6 month, at below the knee level to be 9 month, and the whole stickman to be 12 month. Now let's correlate. At 3 month, at 3 month the child develops neck holding, corresponding to this figure. At 6 month the child learns how to flip. Flip means from prone to supine and supine to prone, prone to supine, and vice versa. At 9 month the child develops crawling. At 1 year the child will start walking independently. So this is an easy way to remember by through this stickman. At 3 month there is neck holding. At 6 month there is flipping, from the child can flip from prone to supine and supine to prone, vice versa. At 9 month the child will start crawling, and at 12 month the child can walk independently. And in between these events, some events occur which are some more events occur which are at 5 month and at 8 month. At 5 month the child can sit with support. At 8 month the child can sit without support, and in 9 month he or she starts crawling, and in 11 month the child starts walking with support. Hence at 1 year walking independently occurs, is possible. Now at 2 years the child will start running, and while taking steps in a staircase he uses both feet, so staircase with 2 steps. And finally, here in 3 years the child will be able to ride a tricycle. Remember this, 3 and try, 3 try, tricycle, and he can walk the staircase one step at a time, one step at a time, one step, staircase at a time. He can climb the stairs one step at a time. At 4 years the child is able to hop or jump and climb down the stairs one step at a time. So obviously climbing down is quite difficult, much more difficult than climbing up for a child. Hence the event occurs later in child development. And finally in 5 years the child develops the ability to skipping. Now coming down to fine motor functions. At first let's draw another mnemonic or stick let's draw another way to remember the events occurring in this fine motor milestones. So the first thing you draw is a another stickman like structure. Remember this, and we will discuss it towards this end. So at 3 months, what happens is the child loses grasping disappears. So for this grasping means catching of an object like fingers, like it's an innate response that is developed in child. So when does grasp develop? The grasp develops by birth. At birth, the grasp is present. Grasp is present, hence at 3 months the grasp is lost. Then at 6 months, let me write it down first. Drop an object when another object is given. Say I have 2 markers here. Say I have this marker in my hand and this marker I like it. So if I am a 6-month-old child and I like this red marker more, then I will drop this black marker and take this. So this ability develops at around 6 months of child development. So let's move on to 9 months. At 9 months, a very important event occurs, that is pincer grasp. Mind you, this is one of the most important question to be asked in Viva, and a very important milestone. Pincer grasp means this, like carrying to be able to grasp an object in a pen or a pencil way, like how you grasp a pen or a pencil. That's the pincer grasp, and it is developed at 9 months. Now at 1 year, what happens is casting occurs. Casting appears, and also mouthing disappears. So what is mouthing? Mouthing means putting of any object inside the mouth. This is quite common in children. So for this mouthing to disappear at 1 year, it must occur somewhere else, right? So this mouthing actually appears at 5 months. 5 months, mouthing appears. And also let's add some more stuffs. Like in 5 months, what happens is there is a bidextrous approach to everything a child wants. Like if I want this marker and someone gives it to me, then I will, if I am a 5-month-old kid, I would try to grab the marker using both my hands. Like if someone gives this marker to me, I'll try to grab it by both hands, and that's bidextrous approach. Bidextrous approach. Now this bidextrous approach is lost at around 8 months, 7 or 8 months, depending upon the book that you study. I read it in 7 months, so it's unidextrous approach. That is, I will try to catch the marker with just my one hand, and at around 7 months, another milestone appears. That is, when someone gives me this marker and I want this marker as well, I can transfer this marker to my another hand and grab this marker. So there is, like, I can transfer the objects in between my hands. So transfer of objects at 7 months. Now let's move on to 2 years. At 2 years, what happens is the child will make a tower of 6 cubes. So his fine motor responses are improving a lot. Tower of 6 cubes, and also he can turn 1 page at a time. he can turn one page at a time, and before 2 years what he will basically do is he will turn a lot of pages at a single time, not one page. So this one page turning ability develops at 2 years, and some more events occur in between 1 and 2 years, that is at 15 month and 18 month. Now 15 month, remember this 5 looks like S. Okay, so to remember this, S for spoon. At 15 month a child is able to use a spoon by itself, and there is more spillage occurs. The child will spill the food. At 18 months what happens is the child is able to use a cup and slight spillage occurs. Slight spillage. At 3 years the child is able to make a tower of 9 cubes. One more event, a very important event occurs, that is handedness. The child develops left or right handedness at the age of 3 years. And finally this figure, moving on to this figure, remember this circle, then this rectangle and a plus and a triangle. So circle, the child is able to draw a circle at 3 years. At 4 years he develops the ability to draw a rectangle or plus. So this is like a 90-degree structure. And finally at 5 years the child is able to draw a triangle. So what happens is this triangle is a complex structure. Remember that it has many sides, angles, etc. Now moving on to lingual milestones. So in lingual milestones, the first what happens is the child at 3 months develops cooing sound. Cooing means C-O-O-I-N-G, cooing sound means meaningless sounds like no syllable. There are no syllables. In 6 months the child develops monosyllable word like pa, ba, ma, monosyllable. In 9 months he or she develops bisyllable word, speaking, the ability of speaking bisyllable word like mama, papa, dada, etc. At 1 year the child is able to speak 2 words with meaning, and at 2 years the child can speak simple sentences. At 2 years the child is able to speak simple sentences. So we can actually say that from 1 year to 2 year there is quite a developmental gap. So there are some more events to be mentioned, that is in 15 month and in 18 month. In 15 month the child starts jargoning. Jargoning means, let me spell it out for you, Z-A-R-G-O-N-I-N-G. This means the child is trying to communicate with you but cannot articulate the exact words, the correct words. Like he will just talk gibberish like blah, blah, is just trying to talk something to you, trying to communicate with you but cannot articulate good words, exact words. And in 18 months the child can speak 10 words with meaning. So at the end of 1 year the child can speak 2 words with meaning. At the end of 18 months, that is 1.5 year, the child can speak 10 words with meaning, and at 2 years he can speak simple sentences. Now at 3 years what happens is the child can say his name, his or her name, age and gender. Name, age and gender. At the end of 4 years At the end of 4 years, the child becomes quite talkative, like he or she will start telling stuffs that's happening in the school, the stuffs that teachers teach, like the children, they can speak, they can recite poems like Johnny Johnny Yes Papa, everything the teacher teaches in school. So at 4 years, the children, they can say, talk stories and poems. And at the end of 5 years, the children can finally do color identification. So these are the lingual milestones, and finally moving on to the social milestones. So in social milestone, the first event at 3 months, the child is able to recognize a mother. Recognizes mother. And before that, the child at 2 months is able to smile. So smiling is one of the first social milestone that occurs in child development. Now at 6 months, the child is able to play with itself in the mirror. Mirror play. At the end of 9 months, the child is able to say bye bye and clap. So one more important event occurs in between 6 and 9 months, that includes at the end of 7 to 8 months. Let's say 7 months. I studied 7 months in my book, so I will be mentioning it to be 7 months. At 7 months, what happens is the child will develop anxiety to strangers. Like the infant cries a lot when they are handled by people who he or she does not recognize. So that's stranger anxiety. Let me write that: stranger anxiety. Okay, we are running out of space. I apologize for that. At 1 year, what happens is the child can wave its head to say no, wave the head to say no, yes, etc. And at the end of 2 years, what happens is the child can have a daytime bladder control. Daytime bladder control in a lot of books I have seen as dry at day and other terms. So I will be saying this is daytime bladder control at 2 years. At 3 years, he or she will be able to do nighttime bladder control. Similarly, I've seen in many books, this is written as dry at night, and at 2 years, this daytime bladder control to be written as dry at day. Now, one more event that occurs at the end of 1 and 2 year, at 15 month and 18 month, is at 15 month the child is able to hug their parents. And at the end of 18 months, the child is able to kiss. They kiss their parents. So, at the end of 4 years, the child is able to attend their toilet needs alone. Like toilet, they can go to the toilet alone. Else, they would always need the assistance from the parents or anyone they know. By the end of 4 years, they can do that all stuffs alone. And finally, at the end of 5 years, the child can dress and undress independently. So, this is the basic milestones to be learned in the undergraduate pediatric level. I hope this lecture helped you guys a lot. Stay safe. Happy Dasai. Take care. Goodbye.